Hi everyone, and welcome to episode 4B of the Disrupt Pandemic Edition. This is our fourth episode, and so far we've covered an array of topics to guide clinicians through this turbulent atmosphere. In our previous webcast, we've uncovered an array of topics from JobKeeper allowance in Australia, healthcare innovations on the horizon, and how disruptive technology is being deployed within healthcare. So today we're really excited because we're going to explore a global outlook on all things health tech, COVID-19, and we're excited to delve into some thought leadership and opinion on this matter. As always, we do have our disclaimer that we do wish for you to read and take into consideration. All advice and content within the body of this webcast is for general information purposes only. Okay, so welcome our guest speakers today. We have a very exciting lineup, starting with Dr. James Samaru. James supports the best health tech startups in the world and hosts the Health Tech Podcast, which has listeners in over 90 countries. He is an anesthetics and ICU doctor by training and has held roles in leadership, management and innovation at NHS England, Health Education England and the British Medical Journal. He's previously directed 2 health tech accelerators, Digital Health, and now he is the healthcare contributor for Forbes. So welcome, James, and thank you for joining us. Secondly, we have John Damante. He has a degree in biomedical science and law, has a postgraduate qualification in business and finance, and he is the managing director of Electro Finance, an industry award-winning finance broking business that focuses on medical businesses and practitioners. And thirdly, we have Dr. Grace Lay. She's a medical doctor, an entrepreneurial leader, and a seasoned strategist for sustainable and scalable businesses in healthcare and fast-growing technology. She is the co-author of Medical Business Management, a guide for healthcare business owners to start, grow, and sell businesses that let them achieve excellence in their clinical, financial, and personal endeavors. Grace, over to you.
Thank you very much, Sophia. I have noted with pleasure that we have someone here who has not only coverage of the medical side and the technology side, but also can discuss at length the UK trends that he's seeing. So, James, during this lockdown, how have you been keeping yourself entertained and amused?
Yeah, good question. I suppose the answer is that I do a few different things. I wear a few different hats, and so it's easy for me to find something to do, someone to help. I'm always on the side of wanting to add as much value as I can and grow a network and monetize various different bits and bobs that way. So lots of people needing help, and so I guess I've been leaning into that, which gave me a few ideas. It gave me a few different things I could do, and actually a new business has spun out of it for me, which I've started actually with my partner who I live with in lockdown, Jessica, and the two of us have put our heads together for a new business to help health tech startups. So yeah, finding lots of ways to keep busy. Let's put it that way.
That's
There's opportunities, right?
Yeah, absolutely, and that's going to be intense. You know, living with your romantic partner as well as your business partner. It's going to be interesting.
It will come with its own challenges, I'm told. But again, the opportunity is great. So it's a high risk, high reward strategy, I think.
Very good. As with all relationships. Is it too early to talk about it, or can we invite you back in a couple of months' time in order to flesh out the?
Well, we can talk about it. I mean, I'm not particularly loud about it at the moment. There's just a landing page. But actually, it's something I've been doing for a while. So because I write for Forbes on health tech, because I've got the podcast now in 100 countries, actually.
Congratulations, we saw that.
Thank you. Belize was the 100th country.
Yes, I heard.
So yeah,
search algorithms working well.
There you go. So because I've been leaning into that communication side of things, I am told that I'm a good communicator, especially, you know, with the podcast and with my writing and all the rest of it. It ended up that I was helping a lot of health tech companies with that side of things. So I was helping founders grow their personal brand. I was helping the companies grow their presence, grow their networks, put out content, even helping them with podcast and video, like a load of that kind of stuff, as well as kind of press releases and getting into the media. So actually, with my partner working in comms and PR, we've put our heads together for something that is essentially a comms and PR agency, and digital media, like all that sort of stuff, specifically for health tech startups. And because
I'm super excited about that.
Yeah, right. And I think because of my networks into the investor world, because of my networks into the like the sales side of things, in the, you know, the hospitals, the public sector, the private sector, insurers, actually for me to, and for us to develop value propositions and a decent content strategy to help people win clients and get users and customers and all the rest of it, it's actually relatively straightforward. And when I look back at, you know, the 2 accelerators that I've run, actually what I ended up helping startups with the most was how they communicated what they do, because raising investment is telling a story. It's positioning yourself in the right way. It's coming across with the right messaging. Winning a customer in a sales meeting with an ops director of a hospital, it's the same thing. It's telling a good story and being a good communicator and actually positioning your messaging as a company and as yourself. So actually, I've been doing this for 10 years, I'd say, that actually it's worth leaning into as a company. So yeah, I've put a team together. There's 6 of us, different people doing writing and podcasts and video, like all that kind of modern media stuff, basically. So yeah, exciting time.
Look, absolutely brilliant. And you know, I run Gorilla Group out of Manchester in the United Kingdom. So I think that, and we help startups that are at the point where they're going to scale up. And I think that that's absolutely an area that a number of us, especially the introverts, need assistance with. And then I can also hear, you know, you trained in anesthetics and ICU, is that correct?
Yeah.
And, you know, that ability to communicate short, sharp, you know, what did they say, 1% completely crapping yourself, 99% relaxation for anesthetic, but that ability to put that message across quite quickly must have absolutely played into this. How do you find startups need to tighten their communication, and even healthcare business owners?
It's a really good question, actually. You know what, I think any medic globally will innately be quite good at this, because if you're in a handover or if you're in an acute situation like that, you need to distill an insane amount of information into one sentence, one word sometimes, you know, to tell a story and get your message across. And actually, I think, you know, creating messaging that's succinct is actually something that medics in general are extremely good at. I think it then obviously is amplified in anesthetics because of the level of acute situations and everything that needs to be done, that actually you need to communicate a heck of a lot in like a look or as I say, just a word sometimes. But I think along with that comes like the reading of it as well, and being able to read that information and that correctly. And I think I've been blessed with emotional intelligence, I think, and gifted with that as many people have told me. So being able to read different people and understand it allows me to communicate better as well. And I think that's what's led to the podcast being relatively listenable, what I'm told, and all the rest of it. So on you know, a topic that could be quite dry. So, but yes, I think all startups can benefit from a second pair of eyes, or, you know, if they've got it in the company or externally, from distilling their messaging into something that they want to be putting out there. And because the perception of what startups do is often extremely different to the reality of what they actually do. And I think so much of it is in a really simple exercise, which is defining your key messages. What are the 3 or 4 things that you want to be known for as a company? You know, it might be, we save the health service X amount of money. We are the highest quality EPR. We are the, you know, whatever it is, whatever the 4 things are, it's worth defining those and making sure that every time you communicate, every time you're out there on a podcast, on a webcast, writing a blog, speaking to someone, those 4 things, 3 things are just repeated again and again and again. It's the sort of Donald Trump school of messaging, like just say the same thing over and over again, and eventually people will understand and probably believe you. The next bit is proof points. I think that's where Trump might struggle, but I think if you as the company have got a lot of things that prove those 4 things, then you're well on your way. Then it's very easy to create value propositions from there. And yeah, that's pretty much a communications 101, right?
On that point, I find it really interesting because I mean, especially a lot of health tech business owners are clinicians themselves. That's what, nurses, doctors, etc. They've seen the need essentially arise from their day to day, and the challenge there is that their proof points typically go towards the scientific, and yet I think, humans really do buy emotionally and validate scientifically, mathematically. So where are people going wrong when they do their pitches or their sales points?
So I think it's a really good point, actually. That, on the logic that I said before, medics should be great at this. I think, medic founders are, well, let's do it this way, right? If a medic's talking to a medic about something in medicine, they will understand the recipient of the information, so they understand how to condense the information for the recipient. If they start a business, the chances are, unless they've had experience, if they're a first-time business owner, founder, they don't understand the recipients of the information from a business perspective. They don't understand the customer or the investor or the whatever it is, right?
And that's where you and I kind of come in, right? Because we've experienced both sides of that. Yeah.
Exactly, right. And I think this is the value of where I've eventually got in my career, that I've experienced so many different vantage points of the health tech ecosystem. I've been a ground floor clinician. I've worked in policy, which is well worth understanding. I understand how money moves at the back end of healthcare. I've worked in accelerators, which help startups with a variety of things and, interact with a variety of different elements of the space. I've been an investor. I've done all the different bits, right? And I've worked with charities, I've worked with insurers, I've worked with reinsurers. And so I guess an understanding of all your different stakeholders, to start the sort of corporate bingo here. But if you've worked in all those different bits and you understand the different people that are receiving your information, then you know how to craft your value proposition for them. So for insurers, it's worth talking about risk. It's worth talking about risk reward. It's worth talking about things that way. For clinicians, it's about quality and safety. For investors, it's about return on investment and the finances. It's about, for hospitals, it's about health economics. And so there's different phrases, there's different language that you can use. But I think if you're a health tech startup owner, founder, it's worth doing some work to understand how these people talk to each other and how they think, and particularly what language they use. There's one of the things I did was a degree in education, and there's an educational theory by a guy called Etienne Wenger called Communities of Practice, and it basically talks about how, call those different people, investors, insurers, reinsurers, different communities of practice, right? If you're a newcomer, you'll be on the periphery. It's like a circle. It's like a dartboard shape kind of thing. And as you come in as a newcomer, you're on the outside, and you need to walk like them, talk like them, be like them, hang out with them to work your way into the center before you can then start evoking change in it. And there'll be people at the center driving it. So as a first-time founder or a founder in the business doing something slightly different than what you're used to, you need to work your way into that community of practice by understanding how they talk and think, and then eventually they will consider themselves like you and they'll trust you. And it's a convoluted way to think about sales potentially, but I think it quite nicely articulates a lot of things that I've actually genuinely experienced about how to get in with people and get them to understand you.
Well, there's a good biological analogy to that. So this is probably a good point in order to bring John into the conversation, where, he's had to work with a lot of healthcare people trying to straddle and get over the idea of communicating their business dreams to backers like banking organisations. John, did you want to expand on what James has said about what you've noticed for healthcare business owners, what they need to know?
Yeah, definitely. I think it's a rare breed when you meet someone who is, especially a first-time business owner, that understands the clinical side and also the finance and the business side. It's very hard to I guess understand both sides of it, because it is very different communication-wise, but also what's required. You tend to find, what I find is a lot of the clinicians that we very good technically in what they do and what they want to do and what they want to, I guess, implement doesn't necessarily agree with what their accountant is trying to do or what their practice manager is trying to do. So there is that I guess that that gap. But as I think when people sort of experience it a little bit more and become a little bit more savvy in that side of the business, if they choose to, there's some amazing businesses where I think they've just hired experts to do that part for them. But yeah, it is one of those ones that it is the messaging and the language is also very different. Completely agree with that, James.
I might throw over to Sophia now, and she's going to draw a contrast between our two countries, James, the UK and Australia's response to COVID. Sophia. Yep, thank you.
Sure. So on the topic of sort of investment, you talked about, medical practitioners who are going to possibly go entrepreneurial. We did note in your article on February the 24th, you talked about Octopus Ventures and their research into medical health investment. Can you please tell us what you think will happen to the pattern of spending before COVID-19 and afterwards, and whether generally the pattern of VC spending will change?
Yeah, good question. And I suppose no easy answer. I think there are obvious areas that are going to see a bit of investment short term. Like for example, we've seen the stock price of some biotechs just fly up that are doing COVID-19 tests. So I think 4 of them in particular have just gone 400% upwards. So there's obvious places like that. If we're talking more at the startup level, I think there are some telemedicine businesses that are obviously doing quite well. Telemedicine's an interesting, wasn't it? They've had this slow and steady growth, struggling to find a true value proposition, people just sort of gradually coming to it as the demand increases. But obviously with COVID-19, it's just massively accelerated because the value proposition's just been thrust into everybody's front room, right? So we're definitely seeing some stuff there. I think with VCs, right, look at it like this very practically. If VCs have got a fund, they've previously raised a fund from LPs, limited partners, i.e. the people who invest in funds, they've given these VCs a load of money, they have to spend it. Their business model is, if we have a £60 million fund, we have got to spend it in years 1 to 4, and then we harvest it in the rest of the time. So if a VC fund was investing before, they're still going to be investing now. The challenge is getting to know them over time through video calls that you can actually get the investment from them. I think that's still a difficulty. I think it's going to be tough, or potentially it's going to be tough for those VCs to raise more funds. I think it might be difficult for VCs to go and raise from LPs. I think that might be difficult. So I think the knock-on effect might be kicking the can down the road a little bit. But I think ultimately, yeah, okay, we can talk about a bit more in mental health, a bit more in telemedicine and different bits and bobs. But ultimately, I think this is just throwing a grenade into the market, to be honest. And who knows what value propositions are actually going to be sustainable for the long term, because you can jump on these short-termisms and throw a bit of money in here and there, particularly the angel investors, looking at this and being like, oh, this person has just spotted something in the here and now, and they might grow something a little bit. But VCs think long term, 10-year funds and those sorts of life cycles. So actually, VCs are unlikely to get too distracted by what's going on right now to make a quick buck. It's just not the way they think. So I think it's more going to be imagining what is the world of tomorrow on the back of this. A lot of things are going to go back.
Right.
Some things are going to change. And I think if you're an innovator, it's predicting and jumping on the back of and having the vision for how is behavior going to be different, and what can I build from a technology perspective that's going to either enable that or hijack it and be the go-to thing on the back of it. So I think the future of work is a really interesting one. Perhaps, yes. Not necessarily in medicine, although we've seen from telemedicine, there's some gains to be made in the future of work from a telemedicine point of view. But I think that's a really interesting one. What does the future of work for healthcare look like? Is there going to be more appetite for remote clinics? Probably. is, are we going to rethink outpatients? Are we going to rethink 5G robotic surgery for remote these are the types of things that people are going to be thinking of, because it's going to be more into people's minds. It's not going to be so ludicrous that a surgeon in London puts on a pair of gloves in a VR setting and is doing surgery on someone in Ghana. Like, that's not too hard to imagine with 5G and what's going on at the moment, right? But 6 months ago, that might have seemed a bit like Star Trek, but these are the things to think about, I think.
Awesome, thank you, James. And we do allude to some of those futuristic technologies later in the presentation. Now, moving on to some more topical in terms of the difference between the UK and the AU, as you've alluded to, Grace. Now, obviously, in the past week, we've had the announcement by Boris Johnson, which has raised a few eyebrows, red flags, smiles, sad faces, I'm not quite sure. But we'd just like to sort of get your sort of opinion on what you think about this, because from my perspective, obviously I'm a UK citizen who's moved to Australia, and I'm frequently in contact with a lot of people in the UK, and I personally found that the restrictions and the response was quite slow at the start, and I was quite alarmed to see that, for instance, international travellers who do arrive in the UK aren't quarantined for 2 weeks. So we've put some facts and figures here on the slide, which are really quite interesting, and we'd just like to hear your insight as to what you possibly would have done differently if you were Boris Johnson, and if you think that the UK response is of a good standard. And I'm not quite sure how aware you are of how we've tackled things in Australia, but any sort of thoughts and comments in that area?
Yeah, okay. So look, hindsight's a wonderful thing, and a bit of a politician's answer from me potentially, but I think it's easy to look back and say, should have done this, should have done that. The facts are still the facts. Highest death rate in Europe, all these different things. Yes, we were slow to adopt things. Look at Germany. There's loads of things you can say. I think ultimately it's always very difficult. I always lean on the side of admitting when I don't know things and trying to get more information. That's my default, be that my evidence-based medical background, all the rest of it. That's just not the way that politicians tend to do things. They pick one and say they're right and will defend that until they're blue in the face, never admit they're wrong. So I struggle to understand politics from that point of view. It was interesting listening to Keir Starmer, actually, who's the opposition leader in the UK at the moment. And, he was challenged on a few of these different things and said, should the government have done this? Should the government have done that? And the thing is with COVID-19 and what he sort of said, and I'm paraphrasing, is kind of what I've said, that ultimately we didn't know. We didn't know how things were going to be if we picked one or picked the other. There just wasn't enough information. And so, when the leader of the opposition isn't that quick to criticise Johnson on certain things, I'm not going to here, right? I think it's not just Boris Johnson as well. He has a chief scientific officer, he has a chief medical officer, and they have a huge amount of teams of civil servants and special advisors below that who are informing those decisions. And trust me, a chief scientific officer and a chief medical officer will be reliant on data as to what they do. Now, they're obviously only making recommendations to the government, and the government does decide what they want to do. But people have argued, you're picking the economy over lives and all this stuff. I think any kind of reduction of information to like a simple trite sentence like that just removes all context. And there's arguments to be made about, is the right thing long term to pick an economy over short termism, and we don't know. And this is the thing, like we just don't know. I'm pretty central when it comes to politics, and actually I can see merits and criticisms of both sides a lot. And I think I don't know, it's hard, right, to say what should have been done ultimately. But as I say, the facts are the facts. Had we gone into lockdown quicker, would things be different? Yes, they would. Would I have made that decision at the time? I have no idea, because I don't know the pressures and I don't know the information that was given to them. But also, I mean, I've been party to like conversations from the ITU consultants across London. Have got a few groups where they communicate, and in these groups, even they are just saying, like, we don't know how to treat this thing. I've tried this. Ventilation's doing this, CPAP's doing this, PEEP's doing that. Like, there's loads of different ways, even within the way you treat this. But those are a cohort of people that say, I don't know, to each other. They sort of try and share the data, and they try and go on what's best after that. So even with the level of patients that they're all seeing, there's still a lot of unknowns about what this disease is doing and what it could do and all the rest of it. All I would say is that, the decisions that I think have been made for a reason, and unfortunately they haven't gone right or what everybody wanted. Chances are that, as we know, there could have been different decisions made, but we weren't party to them, so we don't know the inside track.
Absolutely, thank you. And I totally agree. Obviously, this is, I hate to use the word, but it's completely unprecedented. And even just like with the stats, so some of the research that we conducted, Australians were a lot less optimistic about COVID-19, yet UK, Brits were, which is, might sound startling compared to the actual, cases. So that sort of lends us to thinking about how we can anticipate how the government will change their spending habits. So in particular, with regard to hospitals. So maybe, Grace, I'll hand this over to you in terms of Australian healthcare spending, and perhaps we can engage some discussion on what sort of changes we might expect there.
I think the big point that I've heard, and this is not just healthcare, but across the board, the crisis has precipitated this situation where if the government had been previously like 60% of the healthcare spend plus, or any of the particular areas of spending, that they're very much facing a situation where they're almost going to be 100%. Like last week we interviewed Leo Gui, whose chatbot company has been incredibly successful, selected by Facebook to be its representative here in Australia, in the Asia Pacific region. And for him, there is no slowdown. What slowdown? Because everybody's essentially driving towards a digital economy. And James made a point before about healthcare essentially driving also towards having that moment where they start actually thinking, well, maybe it's not that ridiculous to actually move a number of our stuff online. And what I wanted to ask James was, where do you see the business model? And I guess this is a healthcare spending discussion, but where do you see the business model change where a number of different types of specialties like surgery, dentistry, anesthetics, they don't crystallize their earnings moment until they actually touch the patient? How do you see that changing in terms of our delivery of service?
I mean, I don't know, to be quite frank. In that exact example, as you say, if the monetization happens when surgeon meets patient, and it's not happening, there's going to be no transactions, and therefore there's nothing to siphon off, and therefore that as a business model isn't as attractive. I think the effect on that kind of thing and that kind of space more lends itself towards things going towards prevention. And I suppose, we're seeing a lot of traction with the AI companies right now, right? People like Skin Analytics and Fibris and companies like that are doing AI for dermatology, AI for respiratory disease. And take the dermatology example, I think you might see, because hospitals can't, get their revenue from the surgeries. I mean, I think this is a bit of a leap, but they might be looking more towards ways that they can run clinics with preventative stuff, and it just depends where they monetize, right, as well. And I think this changes globally. Like here in the UK, we're dominated by the NHS, and so there's weird incentives and perverse incentives sometimes for saving money in the community. So if you're a hospital, you wouldn't pay for anything that saves money out here, and there's all these different difficult like money boundaries and budget boundaries. But we are seeing that kind of thing. You know, we've seen University Hospitals Birmingham adopt skin analytics and start testing people out in the community. We've seen Fibris get contracts in 20 different sites to start predicting new respiratory disease in people in care homes. So I think those are the models which are becoming more interesting because they can happen now, because it can be done right now. So I think that's more what people are going to be looking at in the short term is, I suppose, what can we buy that's going to make a difference and potentially save us down the line? Because I think the other thing about what you're saying is that because those elective surgeries aren't happening, because those clinics aren't necessarily happening, there's actually a hump in the road down the line where things are going to present later. Cancers are going to present later. Chronic disease is going to present later. And so that's going to be a cost burden on the institutions that have to pay for it from a healthcare point of view. Now, obviously, it's a burden on the patients, and obviously there's a very human cost in that. But we know that if you're going to change the system, money matters. And so by people essentially proving the point that, okay, in my space that I have a startup in dermatology, if you don't diagnose people early, they're going to come at you later. You're going to have to do more surgery to remove stuff. There's going to be more complications because things might have spread. Actually, it's in your interests to buy this stuff now. And so we can do a preventative clinic and all the rest of it. And by the way, it's AI, so you don't need to do anything. We can just run it remotely. So, those are possibly the sorts of business models that are going to become more and more interesting.
I'm going to bring John in on it, and I'd love for you to talk, John, also about like the ability to front load a business model as opposed to backload a business model too.
Before that, I just wanted to get your take, James. I think you wrote an article late last year about where the UK sat in AI development, and how that Microsoft's report sort of mentioned, the UK had that danger of falling behind, the rest of the world with AI development. That was obviously pre-COVID. How have you seen, the uptake now, and where do you see the UK, compared to where it was relatively, was it October and November last year when you wrote that article? Yeah.
Massive increase in the UK point of view, and I'm talking about health specifically. But in the UK, we set up NHSX. There was a bit of skepticism as to what NHSX would actually do. Is it going to be this cool department that actually does stuff? Is it just going to fall under the same bureaucracy? They've done a heck of a lot from what I've seen. Genuinely, I've spoken on a few of my podcast episodes about the bits specifically that they've done. In fact, even my episode on Sunday, they've released a specific AI checklist, and it's only a couple of pages long, which again is remarkable for a government report to be a couple of pages long and actually succinct. But it's literally a 10-point questionnaire for which they are giving to hospitals and saying, these are the 10 questions, or there's actually 30 odd questions in it. Here are the questions you need to ask an AI company if you want to buy it. Here are the questions, bang, and it's all sorts of stuff in there. And it's dead on. And they literally pulled questions from complete and utter AI experts that I go to and trust, like Hugh Harvey in radiology and all the rest of it. And they literally just pulled questions out of his blogs and stuff that he was talking about. So they're really connected to the ground floor on this sort of stuff. And by doing things like that, they're making the ground extremely fertile, because organizations are more willing to have those conversations with people. There's a lot more learning about AI from the people that do it to the people that need it. And they've put out, NHS put out a load of reports and different bits and bobs. And I think, here in the UK as well, we've always had a huge amount of universities. We've always had a huge amount of hospitals. The setting is there. We just needed things to, grease the wheels a little bit. And I think what I learned through my career as well is that policy can do that. People think policy is boring, and it is, and it can be slow. It is, but actually, if you make policy change and you incentivize organizations to buy things, people are going to buy things. If you incentivize startups to build things, they're going to build things. So if you give government grants, if you give financial incentives for organizations to buy things that they might be able to defer payment or get it on a tariff or all these different things, policy can actually make a huge difference. And there are people lobbying for this stuff very successfully, and there are people actually jumping on the backs of all these things and delivering it. And yeah, I've seen a huge amount of AI, and actually, even just by definition of the space, right? Prospective studies are starting to be done on AI products now. So not testing AI on data that already exists, but actually putting it out in the field and testing it now. That has led to it actually being bought. Examples that I've mentioned, Phoebus and Skin Analytics. So like, and that's happened all in the last sort of, 12, 13, 14 weeks. Like it's literally now, but I think the groundwork's been put in for a long time. And, the NHS have set up an AI lab and all these different things. And whilst, okay, they might not be in there every day holding startups' hands and dragging them into hospitals and doing all these things, the fact that you can talk about AI in the same conversation or same sentence as the NHS and NHSX and hospital organisations in the NHS, the fact that these conversations are happening gives hope and optimism to everybody else that people think they can build it. There are medical students now hearing this stuff thinking like, oh, I could do a bit of data science. I could do a quick data science degree, a couple of years, and come out and build something for healthcare. So like, I think it's it's been a slow moving change, but actually reaping the rewards now, I think. And I think that will only accelerate going forwards because people are just not happy with one career anymore because it doesn't feel particularly safe or interesting. And so you're getting medics studying computer science, data science. Those two cohorts of people are meeting each other, talking to each other, coming up with new ideas, the meeting of minds who think about things completely differently. So yeah, I think we've made a huge amount of ground, to be perfectly honest.
Yeah,
Amazing.
Sorry, go.
Yeah, I was going to say it's amazing insight, and especially for our listeners, I guess, and I guess the general theme of what we're doing is to sort of highlight certain technologies and trends that's happening, not just here in Australia, but overseas. But, I guess if I was, a healthcare practitioner now and then looking at where my business is currently, looking at what you just mentioned, it's a great sort of insight to sort of go, hey, what in my experience and, what do I find frustrating in what I'm doing now that I can turn into, a quick pivot within my business or in a completely different field while I'm, dealing with all this other, COVID, everything as well. So
and the thing is, dude, frankly, if you're a hospital, if you're a startup, right, in Australia, the US, Singapore, wherever your listeners and viewers are, if you want to sell to a UK hospital an AI product, you literally just have to take this checklist and just make sure you can answer all the questions, because those are literally the questions you're going to have in your sales meeting. So if you're building your company, you take that checklist and you go, these are the things I need. I need a quality management system. I need to understand this. I need to understand the bias. I need to understand, and these are the questions I'm going to be asked. So actually, even from an early stage ideas point of view, which you're alluding to, all of these things are out there now. We know how people are thinking, and I imagine there's going to be some shared learning across the world from all the different organizations and startup. It's all happening now, and I think it's super exciting space to be in.
And I love the UK environment for the very fact that the government is probably one of the most generous in terms of its grant systems. It's the most adventurous that I've seen. And as you alluded to, February 2019, they put out that code of conduct, which allowed people to have a framework in order to hang their decision making off with regards to artificial intelligence. And realistically, I haven't actually seen that kind of equivalent here in Australia or even in the US. And the other great advantage, of course, in the UK is that it's realistically the one health system. So if you go from coast to coast, excluding Wales, of course, and Ireland, you're really dealing with the same kind of healthcare regulations, right, universally applied. You don't have to account for each different state as you move across the US, for example. So, John, I think we were talking to you a little bit about business models and the need to consider the payment aspect of it as you go through each part of the gate. Did you want to add anything further about what you see is changing with regards to trust or money exchange?
Yeah, definitely. Sorry, completely forgot to talk about that. Yeah, I guess what this has highlighted to everyone, and it's not just for brand new businesses or people that are thinking of setting up, is the need to actually have those conversations with your accountant and your business advisors, and to be able to forecast. Like, I guess personal savings 101 is to personal finance 101 is to always have some sort of savings, right? So what this is highlighted with a lot of businesses, that even the successful ones, is that, there's the balancing of, reinvesting all your profits back into your business for growth and everything else, versus the need to have those reserves, and building your business model to actually have that, first and foremost. I mean, this is a pretty drastic example, but I think it's one of those things that really should be built into everything moving forward. Cash is king, as everyone says, but it really is, especially in times like this. We're noticing some businesses which are really struggling, but then there's others that are making the most, and all in the exact same field of healthcare, for example, where they're really, absolutely going great guns at the moment, and reinvesting a whole heap and buying up practices that are maybe in distress right now, but purely because they had the foresight, or not even just the foresight. It's more of just the, understanding the basics of, putting some money aside, whether or not it's 10% or whatever it is, a small percentage of all their profits at the end of the year, and not necessarily, reinvesting all of that back into, other ventures or other sort of angles within the business. So yeah, it's one of those things that is really important to sort of look at, the funds, not only the funds that are coming in, but the ones that, when you're sitting there with and it's around about the time that people do it now as well, is, the tax planning for the next financial year, is to work out, we're going to be getting this big chunk of money from a profit point. What are we doing with it? Are we distributing it out to every single, to the directors, or is it something where we're keeping that within the company and reinvesting it into something, or keeping it as savings? It's one of those things where you really need to have those teams involved. Right now is probably a pretty drastic example of it, but just moving forward, it's one of those, I guess, really basic business tenets that you really need to keep in mind, no matter what it is, whether or not you're in startup or you're, late stage business looking at, slowly exiting down the track.
Yeah, I think that to pick up on what you've just said there, and James, what James previously said about communication and the need to, I guess, develop sales skills, especially if you're a healthcare clinician that has started their own technology business and they're going into the environment of selling. There's going to be a whole bunch of cold leads, in the sense that, they may not actually be that inclined in order to warm up to consider some sort of capital purchase at this point in time. James, do you have any tips or tricks to the startup healthcare leaders that might be listening to this podcast now?
On sales? Yeah,
I think that conversation.
Yeah, sales for people with a healthcare background or scientific background is often hard. I think, even talking from my own point of view, selling what even I was doing as an accelerator and all the rest of it, because we're taught to be evidence-based. If something's new, it has no evidence. And so if you're building a brand new idea, a very innovative product that's not existed before, and you think it's going to solve a problem, and people ask you, why is this going to be great? You might internally be trying to say, well, actually, I don't know. It might be, it probably will be, but actually, I don't know. And actually, if you genuinely believe that what you're going to do is going to change things, and there'll be evidence that you have to back that up, that's what you need to lean into. And there is a need to kind of go where is a bit uncomfortable. You don't need to be particularly, over salesy and I don't know, that sort of stereotypical door-to-door salesman type approach. My version of sales is based on honesty. I'm too honest with people sometimes, potentially. Other people might say, I say things like, I genuinely would never take money off people that I don't think I could help or make a massive difference to. And that's why I think my service is going to be good for you. And let's have a conversation about what you actually want from it. And I will tell you very honestly whether I think I can deliver, and I'm willing to leave things on the table for that. I'm willing to walk away if I can't.
It is funny how your position ethics, your position ethics do actually then become business ethics, realistically, right? So, yeah. Mm.
And I think there is pressure, there's pressure running companies to change that. And, unfortunately, big entrepreneurs, big famous entrepreneurs, are often known for being not very nice to people. The Steve Jobses and Alan Sugars in the UK, like people like that, they give it a bad name. That you don't necessarily need to be a psychopath to be a CEO. You don't need to drive people and motivate people with fear to get success. You absolutely don't. One person that I follow, and I actively do not follow most other entrepreneurs, is Gary Vaynerchuk. And I don't know if you guys follow this guy, but he's a very positive entrepreneur. He's got hundreds of millions of dollar worth of agency. Might have been a little bit where I got my idea for an agency from, about communication. But, he preaches kindness, empathy, and being nice to people as a way of running a company. So, and has seen enormous success. And I think, his messages individually are just wonderful for how you can be as an entrepreneur and how to run a business.
That'll be
got
really
those messages.
Yeah, sorry.
I was going to say those messages are on his K-Swisses, aren't they? He's got them written down on his sneakers.
Indeed. Indeed. And he leans into it. He loves it. He loves being the person that is going against the grain to say those things. And I think that balance is so important because, again, do you need $100 million business? Do you need $1 billion business? Is 100K business revenue a year enough for you to be happy? These are all messages about entrepreneurship that don't get preached that often. It's like you're only successful if you've exited for $1 billion and like all this stuff. Not true. And I think in health tech, there's a lot of localism. There's a lot of clinicians who see a local problem and can solve it in a local way, and they can solve a problem in their hospital. And they can turn a bit of a profit doing that. And actually to scale it would be enormously difficult and might not work. And, I'd rather encourage people doing that and having a lot more localism than actually saying that it's only useful if you can scale it and you need to get VC funding and grow quickly and all this stuff. It might be very uncomfortable to do that and it might not work. And so, if you're on the VC side of the table, you're going to be preaching that and you're going to be pushing that. But actually, the reality of healthcare is that organizations are extremely different in the way that they do things. Even here in the UK, as you said beforehand that it's useful that we've got this unified NHS where things are similar. Actually, completely disagree. They're not, because every single individual hospital can have a different information governance policy protocol. They can have different job titles. They can have completely different ways of buying things and speaking to people and setting up stuff. Like it's all so different that it's almost impossible to scale anything. And that's why, even when I was, if I'm advising a VC firm or something like that, I think it's interesting when a startup has got a sale in 3 separate sites that are in no way connected to each other. That's when it becomes interesting. But it's like, okay, here's a problem that you might have solved that is experienced in the same way everywhere. Because if you're going to scale something into healthcare organizations, that's the problem you need to find, because it's the issue is that problems are experienced so differently in different organizations, and to find one that's experienced in the same way everywhere is a challenge. But if you find one, you're onto something. There's a few in the UK that have done it, like Perfect Ward and Doctor, and a few of these types that have just found a problem that is experienced the same way everywhere. And I think that is, that's the golden or silver bullet, right?
It's so funny because you and I have really different experiences and probably different experiences as the different people. Like Gary Vaynerchuk is not. I know plenty of people, and I respect what he's trying to say, but my delivery style is much more Bob Iger and kind of those kind of guys. But I understand where he's coming from, and I do understand the value that he's bringing to the conversation. And perhaps the healthcare startup scale-ups that I'm dealing with, maybe they're a little bit further along, where I can see the similarities of how they've entered into each of those particular trusts, etc. Or they've actually gone up the chain and be able to sell to the next level up. And what I can see in contrast to the US startups that I've assisted with and worked with there is that if you are in California and you decided to go to Houston or Texas into the next big medical district that away, you have to find a whole new bunch of people that are board certified for that particular area in that particular state, licensed, registered, able to access that particular hospital.
Sure.
Yeah, and so what is very different, and there's not even a unifying language in terms of the way that they handle data systems. And you're absolutely right. Like dealing with Epic in one system and in one site, and dealing with a whole new system there. The big data challenges are really difficult. So maybe it's just the experiences. It's the same elephant, and we're just touching different parts of that elephant. But what I can see is that for those startups that we have helped scale and scale internationally, in fact, is that there's a very common problem where the human experiences the system as frustrating. So, like for example, if we helped with an outpatients clinic software, and outpatient clinics suck everywhere. Like one of the great things about COVID is that, well, I know that sounds terrible to say that, but is that it really forced everyone to just get really efficient with the way that you handle outpatients clinics now, right? So instead of 20 people coming in, receiving an appointment that basically said, oh, the registrar hasn't given you an MRI form. Now somebody calls all those people, checks whether or not they receive an MRI form, and then they come in if they need to, or they have a video conference essentially. Brilliant. Why didn't we do that beforehand? So
I totally agree. And actually, I think just on that, what we've seen in the rate and pace and scale of innovation that's happened very recently, the ability of organizations to drop certain regulatory hurdles temporarily to let in things like telemedicine companies and all the rest of it, I think has shown people what can be done. And I think what can be done and actually trusted as well. I think people are inherently good. Nobody is going to let's say nobody, the vast majority are not going to intentionally try and get around regulatory hurdles if you drop them and all these different things. And so I think it's given the system, or whatever systems exist around the world, it's given them an opportunity to see what can be done very quickly and how much they can trust the technology side of the world to actually work with them in the right way, and actually nothing terrible does happen. And I think, particularly in the UK, the regulatory hurdles and all the rest of it, and the bureaucracy and the difficulty in getting things adopted is too high. It's too high. There's no incentive for organisations to adopt new innovation. And there's a phrase over here, you don't get sacked for hiring McKinsey. And you don't, but you do get sacked if you try and bring 4 startups in and they all fail or go out of business and don't deliver.
Oh, well, 4 startups,
no
maybe not for your first startup.
Yeah.
But
there's no incentives for organizations to pick innovation, really, because if you keep things the same, you're not going to be sacked. If you try something and it fails and things get worse, you are. And so I think it's showing potentially what incentives can be done, because we know that in this period anyway, in a few certain value propositions, that actually if you let people in and let them play around, we're going to get some good stuff done. And as I say, we've seen it with telemedicine.
I don't know what it says about, I hope it doesn't say anything about the Australian healthcare system, because, having experience selling in the healthcare system, there are lots of people that we found to want to try startups and have really been incentivized for it, not for any necessarily government supported system like the IUK, for example, which I think is absolutely fabulous, But if I was having worked in both of those two entrepreneurial environments now, I mean, I would take the UK entrepreneurial environment hands down, even over the US system, even, which is perhaps more flush with cash and more willing in order to give it a bash kind of thing. As you've alluded to, there is a lot of reticence in trying something that's unproven. But, with grant funding and with the government support in creating that language and that structure, it really does allow those startups to very quickly penetrate into that core group there. We're just coming up to the hour, so perhaps we can take you out on a couple of questions that Sophia has on the screen there, and perhaps get your 1 or 2 second blurbs on thinking across these areas.
I'll try and be brief.
That's right.
Sure. Well, thank you, James. You've certainly brought some insightful and thought-provoking content to the table. Can I just please ask you, as a young entrepreneurial person myself, what advice would you give to somebody in the healthcare space who's thinking about becoming entrepreneurial, who might be afraid to take the plunge? What sort of concise advice would you give to them?
Don't consider taking a plunge. It's not taking a plunge. If you do things in the right way, it's as simple as finding a problem to solve and just trying to solve it. That's all you're doing as an entrepreneur. It's a simple. I mean, a good quick example. One of the first things I did was in kind of entrepreneurial type things was I used to do this ward round where I had to tell people, computer says no, your blood tests aren't back, and there's nothing I can do for it. So people were staying in hospital too long. So basically I just sat with blood tests and I was like, what on earth happens to this thing? And so I took a day of study leave and just sat with a blood test and was like, where does it go? Followed it to pathology. I was like, what happens overnight? And basically figured out there's a problem to solve here, because overnight there's nobody to run the blood tests. And if they did, they'd save a heck of a lot of money because they'd save on bed days because people would go home. Now, that wasn't a business, but I wrote a business case by ringing someone in finance and going, I've spotted this problem. How do I get this in front of the CEO? And they said, write a business case, I'll help you. And so I did a project where I wrote a business case and I learned about business and I got the problem solved. But that gave me the skills to then spot different problems. And I was like, well, actually a tech company could solve this problem. And so I'd speak to a tech company and then I'd help them do that. And then it just got to the point where it was like, okay, well, I could build something at this point and start a business, or I can just find someone that can solve the problem. So you can get to the same point. And during that process, you'll figure out what you like doing. And if you like if you think the answer is, I want to start a business and do this myself, then you will become an entrepreneur. But it starts with finding a problem that you're super passionate about, that you want to solve.
Awesome. Great answer. Thank you very much. All right, so unless we have any more questions from our panel today, we'll most likely wrap that up. John and Grace, do we have anything further? All right. Okay, so I'm sure everybody who's listened today is being inspired to make some waves in the health tech space. You've certainly changed my perspective on being entrepreneurial in the health sector. And it sounds like you are at the crux of everything, technology, innovation, and investment. So we do wish you the best of luck for the future. I'm sure you don't need any luck. And definitely some advice, if for anyone listening, do head over to the Health Tech podcast because you've got some awesome content on there. So bringing that back to our upcoming webinars. So I believe on the 24th of May, which is a Saturday, we'll be delving into the tax and R&D incentives. So specifically on research and development, which will speak to our startup community there. And we'll also be going into governance. And then I say finish, but we'll likely continue our webcast series, finishing with healthcare startup guidance. So please do stay tuned. And we'll continue to develop that content there. For anybody who has any inquiries, we have our contact details at the end here, and we thank you all very much for tuning in and listening, and we sincerely hope that you're staying safe. Thank you.
Thanks, guys, and thanks, James.
Thanks, James.
Thank you.